I'm alone in this room, so I unmask myself. Good afternoon, viewers. I am Dr. Amitabh Biswas from Sunitra Family Eye Care Center, Kolkata, with our weekly Facebook Live patient education series. Today is being the 36th episode. Welcome, Shagato, Swagat, and Swagatam to you all. Today's topic of discussion is rather hot, contemporary, and very relevant to all of us. We have with us two COVID pandemic frontline workers who are experts in their individual areas of work. To begin with, I have the pleasure and honor to introduce one of my MBBS classmates from CMC Vellore, Dr. Usha Titus. Usha, I think if you're alone in the room, you can remove the mask now. Welcome. Usha postgraduated in internal medicine before moving on to the call of public service in healthcare administration as an IAS topper. She has left a mark with pioneering positive contributions in various capacities. District Collector of Calicut, Registrar of IIT Chennai, Kerala State Secretary Health, Medical Education and Social Welfare, Joint Secretary Government of India, Kerala State Principal Secretary of Higher Education and Environment, and presently working as Chairperson and Managing Director of a Kerala government company called Additional Skill Acquisition. Welcome, Usha, once again to this show.
Thank you.
Okay. I feel proud to also introduce to you another of our MBBS classmates from CMC Vellore, Professor Wilson Philip Burgess. Hi, Wilson. You may unmask yourself if you are alone in the room. Dr. Wilson postgraduated and specialized in pediatric medicine and is currently a professor of pediatric infectious diseases, also additional deputy chair of Hospital Infection Control Committee, and also faculty of clinical epidemiology at the alma mater parent institution, Christian Medical College and Hospital, Vellore. He has the experience of having conducted research with vaccine trials, vaccine preventable disease surveillance, and biomarker studies. Welcome, Dr. Wilson. Both of you need to unmute yourself. I'll do that for you. Yeah. Yeah. No? Yes.
Now I'm unmuted. Thank you.
Okay. You see, today's topic, we'll come to the discussion straight away. Today's topic is coronavirus, act responsibly. So what are we here for? We are here to share the responsibility that each one of us shoulders as citizens of the country. And to highlight the issue, I have one picture to project to both of you and to our viewers. I hope you can see my screen. Can you?
Yes.
So this basically shows graphics or a graphical representation of the rapid rise of new cases that is happening in our country over the last month or less than a month. The rapid rise in the number of deaths. But then there is a silver lining that the number of recoveries are also huge, meaning most of the cases actually recover. But then, yes, coming to today's topic, we need to act responsibly and take responsibility on our shoulders as well. And for this, I'll invite you, Dr. Usha Titus, initially, to tell us something about your views based on your experiences and your take on this. Please go ahead. Would you like to show any slides to begin with?
Yes. Maybe you can play the video after when I tell you a couple of videos. Okay. So thank you, Dr. Amitabh Biswas, for holding this webinar at a most appropriate time. we as human beings would always like to lay responsibility for calamities at the doorstep of others, the governments, the doctors, the hospitals. But here, in the scenario of a pandemic, of which Dr. Biswas has just shown on the screen, it is very essential that each one of us acts responsibly.
Are you able to see the screen, the slide screen? No?
No. Perhaps many of you know that the SARS coronavirus 2, which causes the COVID disease, is spread through respiratory droplets.
Yeah.
Now,
I'm a little sorry. I'm interrupting you. There is a technical glitch here, but you carry on. You talk. Let me just sort it out.
Right. Most respiratory infections are spread by large respiratory droplets that are larger than 5 micrometers. Now, what is a micrometer? It is 10 raised to minus 6 meters. The width of a human hair is only 20 to 200 micrometer. Therefore, this virus, this particle that we are talking about, is extremely small. At the same time, it is larger than a size of 5 micrometer. Now, when these large particles are brought out through coughing, through sneezing, through talking, through singing, they get deposited within a short distance of a surface, either mucosal or another exposed surface. That is why proximity is significant in the spread of diseases, respiratory illnesses. Now you have respiratory infections such as tuberculosis that also have an airborne transmission. They get suspended in air for some time and they can travel longer distances. These are small sized droplets, lesser than 5 micrometer. Now the SARS-CoV-2 virus particles are transmitted both through, are transmitted to a person standing in proximity to a patient as well as at a distance. And that is why we need to act responsibly to prevent the transmission and to protect ourselves. So what are the means by which we prevent a transmission and protect ourselves? One is physical distancing. So anywhere you go, be sure that you are not in a crowd where you can't keep a distance of approximately 1 meter. You don't stay in a crowded space, which is closed in particular. And secondly, you wear a mask. You wear a mask because you're bringing out the virus particle through the mouth and the nose when you are talking or singing or shouting or coughing or sneezing. And since the particles in the air can get distributed or removed by ventilation, try to avoid being indoors with your windows closed. So outdoors is safer for you than being indoors. Now, the other thing is, as mentioned, coughing and sneezing can bring out the droplets. So protect others by coughing or sneezing onto your elbow. Now, if you follow all these, then the effect of each one of this gets multiplied. So you should wear a mask along with keeping a physical distancing and avoiding indoors or crowded spaces, and preferably allowing a lot of ventilation and movement of air in and out of the room. So these are the pictures that you can see. The person wore a mask when going out, then came into the room. Now, when the Professor Walson will be talking in his speech on how to remove the mask. You remove it holding the earlobes. you keep a distance between people of approximately 1 meter. You may have to work with others, keep distances. If you have to cough, you use a handkerchief, you cough onto your elbow. If you wear a protected thereby from transmitting the infection to others or getting infection yourself. Once you are diagnosed with COVID through the test, then you will follow the local guidelines on quarantine, which is generally for 14 days, as the slide shows you. Now, COVID-19 pandemic has changed the way that we have behaved. It has moved us closer to communication through the mobile phone or through electronic means, including learning, and avoidance of public transportation as far as possible. That's why you saw the picture of taking an auto rickshaw alone.
Should I play the next video?
Yes, please. Now we'll focus on masks per se. Now you can see that there are 3 types of masks. One is the medical masks. Medical masks are worn by health workers. They are recommended for those who are over 60 and those who have other illnesses. And where do you wear a mask? Preferably everywhere you wear a mask, safety of your house. But if there is somebody with COVID in your house, you wear a mask again. Now, other than medical masks, you have the fabric masks. Fabric masks are made of cotton, and these can be made at home. You can buy. Fabric masks have to be worn when you meet others. So you have to wear it always. This does protect you of more than 50% from getting the illness or transmitting it. Now studies have shown that double masking is useful. Professor Walson will speak on that after shortly. Now, the third type of mask that is used is the N95 mask, which is generally used to protect where there is a high virus load. Generally, they are used by doctors, nurses, and healthcare workers. Masks with vent or valves are generally are not to be used. They are used in an industrial setting so that the pollutant from outside does not come in. If a patient wears one with a valve, then your virus particle is going to go out through the valve. So do not wear masks with a valve or a vent. Finally, on gloves. Are gloves needed? WHO does not advise the use of gloves. They advise the use of sanitizers or public hand wash stations. Professor Walson can perhaps talk now on double masking.
Can I pose a question to both of you?
Yes, please.
I've had this acquaintance, maybe friend, somebody in a friend's position who once argued with me, non-medical person, why should I wear a mask all the time if I'm in a room where there are 4 other people, and if they are wearing masks, then are they not safe, or am I not safe even if I'm not wearing a mask? So that is one question. So why should one wear a mask is the question to convince such people. And number 2 is what type of mask, as Usha just now said, like there are various types of masks. One should not wear the valve masks, which many people nowadays do wear, and we discourage them at our center also, and we give them a free additional mask to put it over the valve mask as a protection. So tell us more about masks, Professor Walson. We'd like to hear from you.
Sure.
So should I go ahead with your
presentation? That will be great. Sure.
Give me a moment. Yes, we are on.
Yeah, sure. Okay. Right. So this is actually just to summarize what Usha had said, that surgical masks should be used by healthcare workers, those with COVID-19, and those who are directly caring for people with COVID-19, plus those over 60 years of age, and those with underlying health conditions when widespread transmission is taking place and physical distancing is not possible. Now, for most other situations, even a cloth mask should be adequate. Okay, next one.
Should I
So
play
this is
this?
actually a small video on how to wear and care for your mask. So can we play that with the
Yeah.
audio?
Yeah.
Hello. Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water absorbent, and the mid layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID.
So just to summarize what was said in the video, I think hand hygiene or washing hands is extremely important before putting on the mask, before taking it off, and after taking it off. And the other thing to notice is not to touch the front of the mask, because that's the area that's going to get contaminated with anything that comes from the air. And then normally you can all of us do reuse cloth masks. We wash them with soap and water. We try not to reuse them for many days, and you need to have a supply of enough cloth masks so that you can use one a day, discard one at the end of the day. And the other thing to note here is that surgical masks the medical mask is not meant to be reused, and those are what is called disposable, or masks which need to be discarded completely. Okay, next slide.
Dr. Wilson,
Yeah.
can I interrupt and
Sure.
ask a question or make a comment?
Yeah.
See, one thing that important point that came out is that cloth mask or fabric mask is good enough for the general public, the non-medical people, right? And it must have 3 layers. That's a very important thing. The
Correct.
outer layer has to be water resistant, and the inner layer has to be water absorbent. That's what was said in the video, right?
Correct. But the issue with that is, either you have to manufacture that type of mask, or you have. So the issue is quality control. So you don't actually always get the 3-layer mask that with that sort of those properties. But as long as you have a 3-layer mask, that still the middle layer will still act as a filter, and most of the data that has come out with regard to cloth masks is just ordinary 3-layer cloth mask, which is what all of us are available in this country. So that will work in situations where there is, you're not, shall we say, putting yourself at risk by going into an area with high transmission or where there's a high likelihood of infection, like a hospital.
Okay. Just for my own understanding, the middle layer is supposed to be a filter layer. So what kind of filter? Can it be just a tissue paper, or what kind of filter should it be?
No, it still has to be cloth. Tissue doesn't work that well. So
you can use any non-absorbent, polyester material.
Polyester. Okay, that's a good suggestion. And regarding the disinfection of the mask after using it for a day, washing in soap and water. So how many times can a cloth mask be reused after, or how many times can it be washed, reused?
That's a good question. I would say you use it. I mean, what all of us do is we use it till they fall apart, or till the straps no longer, keep your mask, shall we say,
tight and snug.
Snug to your face.
The mask should be chosen so that it tightly fits, covers the nose, and presses against the cheek and comes under the chin. The minute it does not, it sort of lags, as he says, the loops sort of wear out, then you've got to discard it because it's no longer doing the purpose for which it is worn. And it is to make the ends of the mask press against the cheek that you are actually using a second mask, the double mask.
Okay. I see.
And one thing, never share a mask.
Sure.
Yeah, your masks are yours. Never share it.
Regarding sanitization of a used fabric mask, is exposure to sun and air or air drying under the sun good enough, or has to be washed in soap and water, or say ultraviolet light radiation exposure?
You still need to wash it. I mean, people have done this for their N95s at times when you couldn't get N95 masks, putting it out in the sun. But then even UV radiation, UV germicidal radiation has to be a particular wavelength to be able to sterilize, your mask. So I would not actually rely on, sunlight. Soap and water is, there's thing you can easily do at home.
Ultraviolet sanitization gadgets in which the boxes in which you can put things. So can they be used to sanitize masks?
Unless it has been, shall we say, quality controlled, and which is not there in this country. I would not use a UV GI box.
Soap and water is a best foolproof method of doing it. Fine.
Yeah, exactly, and the cheapest.
Okay. So we have, please. Sorry, sure. We can go on to the next topic. Please.
Okay, so this was just to add on to what Usha had said initially. Maintaining distance, cleaning hands, and wearing a mask is necessary. Next slide. So this is points out to the question which you had raised about what is the risk if I don't wear a mask and everyone around me is wearing a mask.
Exactly.
So that's the answer. So if you maintain distance and both of you are wearing a mask, that is negligible risk, as opposed to the very last row in red, where if both of you are not wearing a mask, it's 90% risk of getting the infection. Now, on the right of your screen, the person on the left is the one with COVID-19. The lady on the right is the uninfected person. So the risk we are talking about is for the lady on the screen. So if you're not maintaining distance, but you're still masking, your risk comes up to 1.5%. If you are not wearing a mask in the presence of a COVID positive person, but that person is wearing a mask, the risk is thought to be 5%. But the moment that person does not wear a mask and you are wearing a mask, your risk is 30%. Now, the issue here is there is a certain amount of pre-symptomatic transmission. So there is no way that you can tell whether the person standing next to you or within 6 feet from you has the infection or not, because he may be shedding the virus before symptoms are starting. So which is why universal masking is so important. You may have the infection, you may not know it, you may be infecting everyone in your vicinity if you insist on not wearing a mask. Okay, next one.
Just a personal
Sure.
doubt.
Sure.
This row of negligible risk and the second row of 1.5% risk, I don't see any difference between the pictures in those two lines. Is there any?
That's only the distance.
Okay.
So if you don't maintain the distance, you can see
Okay.
that's still minimal, negligible. Or
Okay.
less, not negligible, it's 1.5.
Okay, we'll go on to the next slide. I got it.
Sure.
Thank you.
So this is the guidance on how to wear a surgical mask, and I think we have a few pictures from the CDC. So choose a mask with layers, and the surgical mask, you do get these thin, what looks like surgical mask with a single layer. I would not waste, my money on that unless you have 3 layers. That is a triple layered surgical mask is what is recommended. The other thing that's recommended is all these surgical masks have an little area on top, which is actually a little wire which can be bent, and that is bent so that it actually covers your nose and keeps it snug over your nose, thereby not allowing your secretions to exit that way. And then the other thing to do is when you put it under the chin and make sure that it's tight so that it doesn't escape the other way. There's a way of finding out whether your mask is tight fitting or not. That's in the next slide. So in that one, what you're looking for is when you breathe each time, does the mask sort of suck in like a vacuum? If your top is snug, then your glasses should not mist up or get foggy. And basically those are the two things that you need to figure out. Now, which is why people actually look to see whether you could use more than one mask and see whether that would help. Just to the next one. Yeah. So before I go to that, this is actually important. A lot of the surgical masks we get, even though they are 3-ply, are the ear loops. Now, I saw Usha was wearing one which is very snug fitting. I got one recently which, literally, maybe it's the size of my face, but it felt like it was falling off my face from the loops. So there is a way of tightening these masks, because just having that in front of you, not snug fitting, allowing you to breathe out your respiratory particles and breathe in others is no use at all. So there's a technique called knotting and tucking, and the next slide is actually a video from the CDC on how you knot and tuck.
This one?
Yes, please.
Shall I play this? Yeah.
Yes, please.
There's a simple way to make your disposable mask fit better, which can make it more effective in protecting you against COVID-19. First, fold the mask from edge to edge. Then, make a knot in each ear loop. Push the knot as close to the edge of the mask as possible. Next, fold and tuck the extra material under the edges of the mask. Hold the mask up to your face and gently push the nose wire against your nose so it fits snugly. Place the ear loops around your ears as you normally would to secure the mask. Be sure to remove any gaps in the mask around your nose and cheeks for the best protection. And this is what we call knot and tuck.
Very helpful.
Yeah,
Very
and I
helpful.
just wanted to mention the other place where this is helpful is for children, because children, depending on the size, the mask you get may not be exactly the size that is recommended, not recommended, which is correct for them. So this knotting and tucking will work even with the usual cloth masks which we get for children.
Excellent.
Okay. Yeah, so this is the efficacy or the efficiency of a mask in preventing, protecting or preventing inhalation or respiratory. So your unknotted medical procedure mask or your surgical mask, like Usha was saying, will block about more than 50%. The cloth mask also blocks about 50%. If you come to the very bottom, I'm skipping the third guy, the lady at the bottom. Now, that is your knotted and tucked mask. And that actually has an efficacy of 77% in filtering out particles. But what they also found out is that if you can combine, if you double mask, you're actually going to block a higher number. Now, why does it help? It helps because your cloth mask helps to tuck in your surgical mask and keep it tight and snug against your face. Now, so next one, please. Yeah. So what so this is exactly what the CDC is recommending now. And one of the things I actually wanted to touch upon is those pictures that you showed first time around the increased rates that are going up. We know there are a lot of variants that are circulating. A lot of these variants are actually due to mutations that give rise to increased transmissibility. And I think that is one of the things that may be driving this rise in cases. So when you have, we are hearing a lot of stories from, people whom we know, from patients whom we know saying, oh, it wasn't like this last time. We only had one person in the family positive. Now everyone in the family is falling positive, altogether. So it does appear as if, the current variants are more transmissible. So the more protection you get, the better. So this is, I think, one of the things that the CDC is saying, why not do your double masking? But then, and this the logic is that the second mask should push the edges of the inner mask. The first mask is a surgical mask. The second mask is a cloth mask. Over that, what is not recommended is to put two surgical masks together. And I think that's in the next slide. The don'ts. The next slide, I think. Yeah, what is recommended is not to put two surgical masks together because they are both inherently loose fitting and they don't actually give you an advantage. And if you are in hospital using an N95 filtration mask, which filters out 95% of your particles, adding a mask over that does not really help. Sure. Okay. So,
I have a
yeah.
logical question.
Yeah.
So, double masking means a surgical mask covered on top with a cloth mask, right?
Yes.
It can't be any other combination. It can't be a combination of 95. It can't be a combination of two surgical masks, right?
Absolutely. And it can't be the cloth mask with the surgical mask over it, which is less efficient.
Why is that? Why can't the surgical mask be outside and the cloth mask inside? Why so?
Basically because with a loose fitting surgical mask on top of the cloth mask, you're still going to suck in from the sides. So in effect, you're only getting the efficacy of a cloth mask and not the surgical mask. So that is just going to protect the front of your cloth and do nothing else.
So I have a question on behalf of one of our staff members at our center. This young lady is allergic, develops skin allergies when she wears a surgical mask. So how can she get by that?
Well,
She used to wear an N95 in the hospital setup.
Okay.
And then the other thing we have also seen with our intensivists, because they wear N95s all the time at work and they are on 8 to 12 hour shifts, is you actually get skin excoriations with the N95 itself. So a bit of what do you call it? Any cream that will keep that area moist, allow that not to dry. Again, which is counterintuitive because you actually don't want your mask to get wet. But you will have to sort of try and adjust the best way you can. And like Usha said, if you can't manage a surgical mask, then a cloth mask if you're not in hospital, and an N95 in hospital.
Yeah. So one last thing about masks, which we must address at some point of time. may not be right now. See, I have a patient family closely known to me. They are a celebrity family, and they pride themselves in not wearing masks, citing the reason that every time they wear masks, they feel breathless. So now we know that studies have proven that there is no oxygen, the dip in oxygen saturation when one wears a mask, right? So isn't it so, Dr. Walson?
That's true. Actually, so a lot of these masking studies were done pre-COVID during influenza season. So what they did is during that time they actually looked to see whether your oxygen saturation comes down, and they found that it does not come down to any significant effect. So a lot of it is none of us are actually used to walking around with masks on, although now 1 year down the line we are better accustomed to it. You take a place like Japan, the Japanese have always worn a mask when they go out, and which is why if you look at, if you have young children who look at manga comics, masking is, basically both the good guys and the bad guys wear masks. So you just have to get accustomed to it. People do say, oh, I have asthma, I can't wear a mask. No, you can breathe through a mask. Sitting in OPD, I have patients who pull down the mask to talk to you because they think they can't express themselves without the mask. And I'm like, please put the mask up. I can still hear you, So,
Yeah, that's a very common thing.
Yeah, people have asked whether they would be breathing in carbon dioxide.
right.
Because, when you exhale. But
I have a WHO slide on that, which I can probably show at the end. If you are not showing it, I don't know whether you have it. In
No,
your slide.
that's not there with me. No, you can show it.
I can show it. Okay.
Sure.
Yes. Shall we go on to the next slide?
Yes, please. Yeah, so this is actually this is the last set of slides, and this is a bit away from the topic of masking. And this is what I know with the transmission going around, with the numbers falling sick. What are the things you need to do to be prepared in case someone in your household falls sick? So the first thing is, you make sure you have all your contacts organized. You have a doctor whom you can contact. You can on tap, and one of the things that we always say is if you have a question, keep it crisp, because he probably has a lot of people calling him up, but you have these things organized, and which is your closest healthcare center, where are you going to go, plan that out. Secondly, your support network. And when we say support network, we are going to say, who are the people? Ordinary things like groceries, it is a miserable feeling. There are situations where district administrations have actually walled off areas. So who's going to get your food in? Can you, panic buy and keep for the next 6 months? No. So you need someone who will buy stuff, at least leave it at your doorstep. So someone whom you can rely on in an emergency. Then essential medicine. So anything that you're normally using as medicines, make sure you have a stock. You never know when you're going, and it's not just that you're falling sick. It may be your block, it may be your family, and what is actually recommended with some of the guidelines is, if you have one person at home who's sick, preferably you to stay at home. The other thing is to decide if there is a person falling sick, where is that person going to be? What is recommended is a separate room with a separate bathroom. Now, this does not always happen in a lot of households. So you need a bed and a chair which is at least 6 or further feet away from the rest of the family. You need a designated bathroom, which if that person is using, can actually be sanitized after each use, again by a designated caregiver. It's good to have one designated caregiver in the house who is meant to look after the sick person, who is not over 60, does not have comorbidities, and knows exactly what to do. The next slide.
Say, can I ask you a question here?
Sure.
Earlier today, when I was talking to Dr. Usha, she might remember, I think Dr. Usha had a question that when you're talking about stocking up on supplies such as regular medicines, so how much of regular medicines? Because nowadays, with the oxygen scarcity in our country, many people are stocking up oxygen cylinders in their house. They are also stocking up medicines like remdesivir and such drugs. I mean, Is it necessary?
Uh, yeah, two issues. One is, if you need oxygen, you should be going to hospital. And I'm going to talk in the next slide about how you're going to figure out whether you need oxygen. The second thing is remdesivir. I know there's this mad rush for things like remdesivir, tocilizumab. None of this has been proved to actually bring down the severity of disease. There has been exactly one tiny study which said, oh, maybe it helps if I started before it, you have critical disease. But most of the other studies have said it's not, and it was never purposed for SARS-CoV-2 infection. And there is no evidence that remdesivir actually is useful. And I think when I was speaking to some of our colleagues from Maharashtra, they were saying that, they're starting remdesivir in everyone in some of the hospitals. We have never used an antiviral for children. In adults, it's been used, but pretty sparingly. So again, stocking up these things is not really necessary. Usha, you wanted to mention anything?
I had a good point about.
Yeah, from a public health perspective also, one should not be looking at remdesivir or any of these drugs. And one shouldn't be stocking up. Because, as everyone knows, we have to conserve our resources and we have to use what is necessary alone. And as Professor Balsan said, if there is shortness of breath, if there is an alarm signal alone, does one consult the doctor and take the advice and go in for oxygen or any of these drugs? 85% of people with diagnosed as COVID positive would not require any of these. Exactly. And 85% is a majority, big majority. So 85% of all those who are hearing this would not require any of these drugs. They would only have a mild fever, maybe a cough or cold, for which a paracetamol or indomethacin, any of these drugs are more than enough. Paracetamol is more than enough. A lot of warm fluids, a lot of good food, isolation.
Dr. Usha, can I ask a question?
Yeah.
Dr. Usha, can I ask you a question?
Yes.
From the public health point of view, all these years since our childhood, we have always seen and considered a thermometer a necessity at every home.
Yes.
Now, with these newer viruses coming in, would you consider keeping a pulse oximeter at home another necessity now, in addition to the thermometer?
A thermometer, yes, absolutely. It's cheap, it's available, one should keep at home. For a pulse oximeter, I would not say that every family buys one, those who can. If there is a lot of COVID in around, which is what is the case now, it is good to have access to a pulse oximeter. So apart from that, pulse oximeter costs close to 2,000 to 3,000 rupees. I wouldn't advise that every family stocks it.
Great. Well, Dr. Wilson, shall we move on to the next
Yes,
slide?
please. Yeah. So this is the question as to what to do when you have someone at home. We touched on a few of these. Firstly, isolation. We spoke about isolation, and I will talk a little bit about the practical aspects of isolation. And then when we come to the next slide, like Dr. Usha was saying, ventilation, keeping the windows open, and the other things is hydration, making sure there's paracetamol for fever, making sure that the mild symptoms are taken care of without panicking. Excuse me. Even in children, we find that close to 90% have, mild symptoms. Only about 10% have your moderate to severe symptoms where you actually need to get into hospital. So just, what we all used to do, for any viral respiratory illness, those are the medicines we need to have. Now, food, the isolated person or the person who is ill has to has his own utensils, plates, bed sheets, pillowcases. The food has to be handed over. And if you have a separate room, and this is from personal experience, what we used to do is keep the food outside the door, and tell that person your food is outside. This of course can give rise to a bit of friction, because the immediate reaction is, oh, you're treating me like a leper. But so psychological support is extremely important. The person who's caring, so the person who's ill needs to have a surgical mask. The person who's caring for that person, who's in, shall we say, the primary caregiver, is should have a surgical mask. If you have a room, then nothing like that. What we used to do, once the food was eaten and the plates came out, there used to be a bowl with soap solution in it, and we used to put the plates in there, and they could be washed. What you're not supposed to share are the personal items of that person, and the personal items of daily use. Okay, the next slide. Yeah, so that is the pulse oximeter we were talking about. So I did put that there, saying monitor oxygen saturation, because it's worrying that people are actually coming breathless. It's good that if you can have a cough and your doctor says okay, what's the saturation, you can, without having to travel to hospital, you can measure it at home. We talked about masking for both the sick person and the person interacting with the sick person. The other important thing is that the sick person should not be in contact with anyone above 60 or with health conditions. So caregiver should not ideally be someone over 60 or with underlying comorbidities. Separate bathroom is preferable. If you have a house where there's only one bathroom, then the caregiver actually has to disinfect the surfaces that are touched by the sick person with either Lysol or a 1% bleach solution. Lysol is available, so that's probably one of the other things you do need to stock, and I didn't think of that. At the end of the isolation period, the room has to be sanitized with soap and water or 1% hypochlorite solution. And again, it's a lonely time to be sitting in a room alone, so by all means, please, it's lonely both for the person who's in isolation and the people who are outside. So communication is the key, Yeah. And that is actually the last slide. So thank you.
Okay. So talking about isolation, Dr. Vasan, I have a silly question, not really pertaining to COVID, but to English language. Is there any technical difference between the word isolation and quarantine?
Quarantine, right. Usha, you want to answer that?
No. Well, quarantine is a technical word which suggests that there is an infection, and therefore even in the past, even before COVID, your dog's in quarantine. When you move between countries, mandatory quarantine is something that is legal. It is mandated by law that you need to be away from social contact for a specific period of time. Isolation is a general word, doesn't have any technical meaning to it. So you can isolate yourself for a few minutes, you can isolate yourself for hours, you can isolate yourself like a sannyasi for years. So, it's that. So in the COVID context, we sort of use it interchangeably, but quarantine has it's more technical and it has a definite time period depending on the law.
I have heard some people interpret this as quarantine is, waiting for you to develop signs of an infection. Isolation is when you've developed an infection and you are in isolation, like an isolation ward. This is actually splitting hairs, but I've heard people, use the term that.
I've also heard this. Isolation is a proven COVID patient, and quarantine is for the patient who is at risk, person who is at risk.
I know. But the fact is, it is a bit of hair splitting, but I know.
Yeah. So we spoke about this misconception about the mask and carbon dioxide. If you think it is relevant, can I show the WHO picture now?
Sure.
Let me see.
Yes.
Yeah, 1 second. Today, my MacBook is kind of in a better. This is the WHO poster, which I thought is relevant to remove a misconception among many people who feel that they feel breathless when they wear a mask. Dr. Wilson and Dr. Usha, would you like to expand on this and talk something about this? I mean, the poster says it all, though.
Exactly.
Yes, it does take a little effort, wearing especially two masks. There is a little effort, but it is done for your own good. So a little bit of discomfort is there, which is a fact, but one gets used to it, and especially when one knows it is for one's good. Now, there's the only thing is we are, all the carbon dioxide will get out through a breathable mask. All these masks are breathable. So the air will move in and out, and we are protecting ourselves and others from that large respiratory particles, droplets.
And for the benefit of the viewers and the general public, especially for people who do complain about wearing masks, whatever is stated on this slide is proven by proper scientific research and not just a statement, right? Isn't it so, Dr. Wilson?
Yeah, correct. Actually, it's actually been done. People actually did look at it, how long can we wear a mask, and these are actually proven by scientific studies that you do not have CO2 intoxication, and neither do you have a dip of your own oxygen saturation by wearing a mask, even for prolonged periods of time. It is uncomfortable. There's no doubt about it. As working people, we all look forward to coming back home and taking off your mask. Okay. But I mean, you just have to wear it. It's not going to cause any. It prevents a major illness, more than anything else. So a bit of discomfort, I think, is acceptable
for the amount of safety that it provides.
Absolutely.
There is another misconception which I'd like to touch on, or a question which many have. I do gymming almost every day, so it's relevant for me also that should we wear masks while exercising? Well, WHO recommends not to wear a mask while exercising. People should not wear masks when exercising, as masks may reduce the ability to breathe comfortably during exercising. So this is a point to keep in mind for people who are jogging or exercising.
It's also because it's outdoors.
Mm-hmm. Okay. Plus, during exercise, the mask can become sweaty and damp. That also, I think, becomes a mess. Right?
True, and you can't use it again, so your filtration is not great. And if you are exercising on your terrace, and there's no one around, then you're obviously safer than you would be doing it anywhere else.
Correct. Another misconception which I thought of touching upon is there are a lot of these game-like things going on in WhatsApp nowadays. But if you can hold your breath from point A to point B, then your lungs are safe. I'm sure you would have also got such forwards.
There are a lot of forwards. Somebody said having spices in your pocket can reduce, drive away the virus.
So I just wanted to make it a point to the general layman viewers that there is no such medical test which can make you safe of holding your breath for 10 seconds or anything like that. That means nothing. Would you like to say anything, Dr. Wilson?
No, that's fine. I mean, that's quite... I think the amount of forwards that come are amazing. I think Dr. Usha touched on that as well, as to what are the different combination of spices you can take to prevent coronavirus entering or, getting into your lungs. So none of that is proved to be of any benefit. Even people have looked to see whether things like vitamin D, multivitamins, have a role to play. And I know there are people who take it religiously.
And a lot of people also take, say, methi water in the morning, or some, some spice water in the morning, soaked water. I spoke to my own dietitian here, and she said that's all crap. It doesn't mean a thing. Best is to follow the three principles which we have discussed: physical distancing, masking, hand washing, and of course, physical exercising and eating well and resting well to maintain good health, right?
Yeah, absolutely.
Yeah. I think I have one more misconcept to talk about. Is there? Yeah. So this is this is to talk about the panic that there is among people nowadays. I mean, general public, many people seem to have panicked, and they are, as we mentioned, they are stocking up oxygen, they are stocking up drugs, they are stocking up pulse oximeters and whatnot. But as Dr. Usha rightly said, 85% of people get a very mild disease, which may be limited to just a fever or a body ache or just a cold or cough. And say about less than 15%, so about 13 to 14%. I know Dr. Walson, he might be having the correct figure, get some kind of a little more than that, but only a very small percentage get seriously ill, right?
Yeah. Yes, absolutely. Even in adults, there's a slightly higher percentage, and that for those with severe and critical illness, that works out to about 15%. In children, the ones who get severe and critical illness actually works out to under 10%. So most people do recover. Most people, I mean, it's a a lot of people have complained that you feel drained, you feel tired, the myalgia is severe, but then there is no need to panic and say, okay, oh my God, I've got it, my family's got it, I need remdesivir for everyone, where do I get it from? Actually, no.
Correct. So just a short while ago, Dr. Usha was talking about forwards. We were discussing these WhatsApp forwards, and that's another pandemic nowadays. Apart from the pandemic of coronavirus, we call it information pandemic, infodemic. That is what WHO has called it. It's an infodemic going on. Our WhatsApps contain so much of misinformation about COVID-19 that it is very important for the general public to understand that what is right to follow and what is not right to follow. No, there are so many forwards about this vaccine is better, that is not better, this is good, eat these spices and this and that. So it's important to filter them. And WHO recommends these 7 steps. First, you assess the source. You go beyond the headlines and read the contents. You identify the author and check whether the reliability of the author. Check the date. Sometimes, some of these forwards are old, years old, and they may not be pertaining to COVID at all, and they are coming as COVID, right? And then you must examine the supporting evidence that has been talked about in the forward, and check your biases. And lastly, turn to fact checkers that you can Google and turn to fact checkers and check out whether it's correct or not. Would you like to add? Any of you like to add anything on this?
Most government sites of states, they carry reliable information, just as WHO or esteemed organizations like CDC, Center for Communicable Diseases. All these carry reliable information. So it's better to follow, government organizations and research organizations rather than, general information that keeps following them.
Great. So we have had a good discussion. Dr. Wilson, I would like you to tell us sometime about the vaccines and choice of vaccines and about vaccines. There are so many doubts and questions on vaccines. Maybe we can have another session on vaccines and treatment modalities sometime. What do you think, Dr. Usha?
Yes, that's needed. Today, the COVID site will open for 18 plus age group for registering. So that's a big doubt whether, who should register. And if one has had COVID, what is the period after which they should register. Then vaccines in pregnancy and lactating mothers. So Dr. Walson is the right person to talk on these topics. So Dr. Biswas, I would suggest that you hold your webinar next on the topic of vaccines.
Yeah. But while on this topic, I would also like to encourage all our viewers that all those who are 18 plus must take vaccine and not really go by the media publicity of the side effects of vaccines and get scared. The side effects are rare. Side effects can occur with any injection, any medicine, or any vaccine. Every medicine has some side effect, and every vaccine will have some side effect. No vaccine can be 100% efficient against any illness. So, there's no point cribbing over all these points. It is better to have a vaccination. Dr. Wilson, if you can give out this message before we bring an end to this session, that why everybody should get vaccinated.
So, I think there has been a lot of information out regarding side effects. And I think the one thing we must realize is that, we are in an age like none other, because we are literally vaccinating millions of people in a day all over the world. So rare side effects are there with every vaccine. And normally, all these come out only at, post-marketing, what is called phase 4, post-marketing data, which means you put it out into the real world, and then suddenly this side effect comes up. Take something like pertussis, the ordinary DPT, hypotonic hypotensive encephalopathy is an extremely rare side effect, but it is documented, and it is documented in about 1 million vaccine doses administered. The current ones that are being talked about, like the cerebral thrombosis, if you look at the data, Johnson & Johnson was paused in the US, and that was paused when they had approximately 4 cases in 1 million or 10 lakhs. So, and they said it's so rare. And the way to look at it is to actually compare those side effects with the risk of you getting the disease. Coronavirus itself can and has been documented to give rise to cortical and cerebral venous thrombosis, basically because of antiphospholipid antibody syndromes and hemorrhagic strokes that can happen. We had a lot of young people with stroke in the previous years. You have strokes, infarcts. So compare that, the incidence of those, and you compare that with the vaccine. There is no doubt that there is a risk-benefit balance to be looked at. And almost everyone will say the risk of a side effect with the vaccine is minuscule compared to the benefit you get with the vaccine.
Dr. Wilson, I have just received a question from one of my live viewers here within the center. Sure. You being a pediatrician and the vaccine being available only from 18 and above. So how do you advise? What advice do you have for children?
So we are encouraged by the fact that children tend to have more asymptomatic and mild disease compared to adults. However, vaccines that are coming out, AstraZeneca has started trials in children aged 6 years and above. The other vaccine manufacturers have started from 6 months and above. So that is, So we hope to have, data with regards to vaccinating older children within maybe, 6 months. If you have a child at home, the main thing is to try and make sure that they are kept safe, from other adults who may be carrying the infection. Teaching them masking, even when you're going out. I've seen children around 2 years of age, wearing masks along with their parents, and they think it's a great game, to wear a mask, and, so that is something you can absolutely teach children. The other thing that has actually happened is data from the US has shown that maternal antibodies come up after you vaccinate mothers, which is not being done at present, but also in the breast milk if you vaccinate lactating mothers, which there is actually no contraindication for. A lactating lady can take a vaccine. She is going to put out antibodies in the breast milk, and we know this happens all the time. Most children don't get respiratory infections till after 6 months because maternal antibodies in breast milk protect them. So that is one, subset of children whom we can actually protect by ensuring that lactating mothers are vaccinated. But pediatric vaccines will come. We just need to be patient. We need to teach our children, the same principles that we are talking about: distancing, safer for them, mask for a child about 2, washing hands. In fact, children love to wash hands. They see water, they run. And in the old days, it was like, hey, please don't touch that tap when we want to run out of water. Now it is, please wash your hands. We are very happy to wash your hands. So that's my answer.
Great. Any closing remarks, Dr. Usha? Or should we call it a day?
We are in the midst of a pandemic and it has come home. We must all act responsibly for our own interest, for the interest of our family, and for the interest of our beloved country. We've got to get vaccinated. We've got to protect ourselves with masks, the right kind of mask, and we've got to keep physical distancing. There is discomfort in all of this. We've got to isolate ourselves. But it is for the common good. It is also for our individual.
Great. It was excellent having both of you for this session. I learned a lot, and I'm sure our viewers also did. I have received comments in the comments box. People have expressed appreciation of the information being disseminated through this program. And we must do it once again about some other aspect of COVID-19 pandemic. Sure. Thanks to both of you, Dr. Usha and Dr. Valsan, for sparing your time. And wish you all the best. Stay safe.
Sure. I want to, before you cut me off from the, feed, I want to thank you and Dr. Usha. Thank you for inviting me. And it's a pleasure to see both of you. You guys look exactly the same as what you looked like when I saw you last and in college. So, but it was great to, and thank you. I also want to mention that the presentation that I made, my resource person has been Dr. Amitava. In fact, we made our own videos here for a lot of these things. And I find, what you managed to get from the WHO websites, those are so informative and so useful even for my own practice. Thank you very much.
My resource person has been my team in our center.
Thank you.
Okay, bye-bye.
Bye, thank you.